Hello and welcome to Edukemy's YouTube channel and editorial discussion for 20th April 2022. My name is Harsh Singh and in this video we shall discuss an editorial from the Indian Express which is titled "The Dead Must Count." The editorial discusses the government data which is 5.2 lakh deaths during COVID times, which are excessive deaths possibly because of COVID, and the discrepancy in data which the WHO claims, and WHO claims the data to be as much as 6 to 8 times this number of death. Let's understand the differences and the way in which data has been calculated and the dispute. If you like this initiative, share some love through likes, comments and shares. The government has said 5.2 lakh deaths because of COVID, and this is the data for the last 2 years. On the other hand, WHO, international organizations, surveys within the country, and through Lancet, they say that the number of deaths are 6 to 8 times this number of 5.2 lakhs. That means around 30 to 40 lakh deaths in the country because of COVID or reasons related to it. Now, this is where the concept of excess mortality becomes important. Excess mortality are those deaths which have happened in excess to the average number of deaths happening in the last few years. So, this is one of the ways in which the extra number of deaths have been calculated with the help of WHO, Lancet, and ground level surveys. So, what they did was they understood what has been the number of deaths that have been happening in the country in the year 2018, 2017, 2019, etc. And then they understood that this could have been the similar number of deaths happening in 2020 and 21 itself. And if there are more deaths happening, report them and subtract this figure, the average figure of year, and we would understand what is the excess mortality. Now, it is true, excess mortality does not mean only COVID deaths. Only deaths of people who have had COVID. Excess mortality will also include people who have died if they did not get food on time, if they did not have employment, and they did not have resources and they passed away because of the lockdown period. Yes, that has happened. People who are migrating back to home, they died, but they also are impacts of COVID lockdown itself. What about migrant workers, food impact? What about people because of COVID, all the health facilities, emergency facilities were diverted towards COVID, and people needing other medical treatment, they did not receive it and they passed away. All of them are the excess mortality, and COVID has to be held accountable for that. So this is the way in which organizations around the world have calculated the data. And on the right, you can see these two images where in one of the images, the complete gas chamber in which uh, the bodies were cremated, electric gas chamber, it has melted down because of excessive usage. And on the other image, you'd see a number of cremations happening at the same time in the crematoriums. Now, on the other hand, the government calculation of data is based on the people who acquired COVID, who are COVID positive just before the time of their mortality. So the people who moved after the hospitals and were COVID positive during those times, those people are 5.2 lakhs, and this is what government says is what we will agree with. On the other hand, WHO says, what about those people who did not and could not get themselves COVID tested? What about those people who passed away, who died, and post death we understood that other people also acquired COVID in families and no test was possible for these people. Now, world over, all this kind of data of people who died, excess death, all are being covered under the COVID and COVID related deaths, that is excessive deaths, right? On the other hand, a lot of researches have happened. For example, compensation, people have asked for compensation for their relatives death. Government has been paying 50,000 rupees per person who has passed away. Along with that, journalists, civil society accounts, data from morgues and crematorium, all have been collected. Whatever you saw in the last image, all have been collected and put at the state level, right? And this data has been taken by WHO to calculate this figure of 30 to 40 lakhs. All right, so this is what WHO's way of calculation and government's way of calculation is. So let's understand what is the issue here. See, if we look at this new number, earlier the number for deaths in India was 5 lakh, and now it would become 30 to 40 lakhs. All right, 30 to 40 million, 3 to 4 million. All right. On the other hand, total number of deaths around the world would surge from around 6 to 7 million to 15 million. 15 million around the whole world because of WHO's way of calculation. And possibly this is required for the time. But then, right now, America, Russia, Mexico, Brazil, all these countries which were attributed to have had more deaths, they will be all below India's count, below India count, and India will be the country with the largest number of COVID deaths, and all these four countries combined will not be able to even total number of deaths in India, that is 3 to 4 million. Imagine this. Right, so India's undercounting is as much as eightfold, and this is far more than global undercounting of deaths, that is threefold. So India is undercounting the COVID deaths. In fact, interstate variations are also very high. In Bihar, it is being said by Bill and Melinda Gates Foundation that the COVID deaths have been undercounted to the tune of 1 is to 20. Only one death has been counted as COVID death, and there have been 20 deaths. On the other hand, for a state like Kerala, the proportion has been very less, 1 is to 1 undercounting only, right? And global level is three folds of undercounting. Now, because of these new data, India will have almost one fourth of the excess deaths that have happened during COVID times in the last 2 years. One fourth of the global deaths in India itself. Now, this runs against the claims that India was less impacted by COVID, right? So that is an issue. Now, see, India says to the WHO that no, your method of calculation is very different. You have divided the world into two categories, tier 1 and tier 2. See, this is what has India has claimed against WHO. Tier 1 and tier 2 countries. Tier 1 countries, you have all the data, and tier 2 countries, you don't have data of the deaths, and you have projected tier 1 data, that is extrapolated data, and then you have said we have had 30 million, 30 and 40 lakh of death. This is what India has counterclaimed against WHO. On the other hand, WHO says no, we will tag you in the algorithm and in the flowchart that we have used for calculation of data. We have used only national mortality data. Only your country data is what we have used. We have taken the data from states, and we asked you for the data. You did not have sufficient data for all the months from all the states, so we have taken the data from state, and we have reported whatever we found from the country, be it the dead bodies which are lying in the rivers, or the morgues, mortuaries, or crematoriums. This is what we have done, and we have extrapolated only to the level of calculation of the excessive deaths in the country. Now, this is where the editorial says that it is we must not think in the track that India has miraculously escaped, or it was less affected because of the pandemic, whereas if the data says exactly opposite. If you speak of the interstate variations, it was also said that states having better health facilities, Maharashtra and Kerala, they were more impacted by COVID than Bihar, Uttar Pradesh and Odisha, which is not true. This is not good for policy making if we do not capture the right data, right? Not only that, we have to understand the extent of disaster. If we treat India as country which was less affected or miraculously escaped the second wave, suppose if we do that, because COVID deaths were very less, you know what it means? It means that possibly Indian genes are better and they perform better against COVID virus, whereas it was not so. Data does not show such things. So this will be against the governance, this will be against science, this will be against protection of people in the long run. There are so many compensation claims, they need to be served, right? 50,000, this is a small amount for families, but then again, we need to do this. And counting is the least we can do for the departed soul, just counting them. This is not a matter of shame for the country that we have high number of deaths, just that it was a disaster of huge impact, and nobody was spared. All we need to do is count the real figures. Nobody has to be blamed here. This is what the editorial says. So a very insightful editorial. Now, a small question for you all. Mention 5 advantages of reporting death counts with the government administration and give examples. 5 advantages of reporting death counts. All right. Now, if you like this initiative, share some love through likes, comments, and shares. And if you have questions, doubt, just put them in the comment section and we will ensure to get back to you. Thank you for watching.